To start off our program, we'll get moving a little bit because we are behind, is Dr. Sean Lager, and he is the founder of Clear to Play, one of the hosts here of this symposium, and it's a nonprofit dedicated to promote concussion awareness and treatment. And being an ex-NFL guy, obviously awareness and treatment is pretty important to guys like me. And he is going to talk about concussion management and the high school athlete. Let's see. There he is. Thank you.
Good morning, everyone. Thank you for coming. Let's see if this works. Okay. So, my name is Sean Lager. I'm an orthopedic surgeon, sports medicine fellowship trained, and thank you for that introduction, Mike. Founder of cleartoplay.org, which is our 501c3 nonprofit I'll talk to you about. And a lot of this that I'm going to talk about now, it's an introductory lecture. A lot of the luminaries that we have today will go in more in depth on some of these topics, but frequently I'm asked, if I'm an orthopedic surgeon, I'm putting people's bones and ligaments back together, what do I know about concussions? And I would say that as a clinician and as a sideline physician for a lot of high schools and colleges, that we are at the front lines, and on a Friday night when it's raining and cold and we're responsible for these athletes, I would love to have a neurosurgeon standing next to me or a neurologist, but I look right and left and I don't see them. So as a physician for a lot of high schools, we are responsible for their clearances and we are there, so it makes sense for us to be educated and try to manage concussions. In regard to how we clear them, we'll go through that as well. In 2010, Governor Christie passed the New Jersey concussion bill, which was outstanding. I think almost all 50 states now have some sort of legislation which has been passed to try to protect athletes, but it was a great day. They had it at MetLife Stadium, and a lot of NFL people were there with press. But really, what type of teeth did this have? And so it did mandate that any athlete in school suspected of having a concussion should be removed from play that day and could not return until they were seen by a medical professional. The New Jersey Department of Education later passed some guidelines, and they named IMPACT as well as a neurocognitive baseline test, which we'll get into. Unfortunately, the legislation is a bit weak. There are really no penalties for noncompliance. There's no funding for the testing. The tests are really not covered by basic insurance plans. Each school was told that they should create their own concussion management protocol. I've met with heads of schools, and I've talked to them about our nonprofit and how we might be able to help them with comprehensive concussion management, and that this is a state law. And I was told, do you know how many state laws we don't follow? So there are some weaknesses there, and there's a gap. And so because there's a gap, and these kids are playing, it's almost like giving them a license to drive and not giving them a seatbelt. We thought that we would help in that gap. So cleartoplay.org was founded in 2010. It's a 501c3 nonprofit organization, and our mission is fairly clear: to educate high school and college athletes about concussion prevention and treatment. We provide free preseason baseline impact testing, preseason baseline tracer testing, which you'll see today, and we conduct clinical research. So the first goal is really to prevent second impact syndrome, which I'm sure you'll hear more about today. We do that by timely evaluating these athletes that were suspected of having a concussion and then having them follow our post-concussion protocol. Second, limit the incidence and duration of post-concussion syndrome, which you'll hear about today. We do this also by trying to provide early diagnosis and supportive care and rehab when needed. The third, provide injury surveillance and monitoring hit counts. Chronic traumatic encephalopathy has been linked to the cumulative effects of head trauma below the threshold of a concussion. Helmet and head monitors are being used in participating school football programs, and they provide real-time notification to the sideline physicians during games. So we'll have a monitor, and I'll get to that in a later slide, but that allows us to sit on the sideline and see the type of hits that these people can sustain. Repeat offenders can be identified, and by reinforcing better tackling and blocking techniques, we might be able to prevent that from happening in the future. So also establishing an injury registry can help track athletes from high school to college and beyond, and hopefully we can identify players more at risk. Fourth goal, clinical research through our fellowship, and also fundraising. Since this is a nonprofit, all of these services are provided for free. So just some basics. What's a concussion? A lot of different definitions and some facts, but some of the basic ones. It's a disruption in normal brain function due to a blow or jolt to the head, which may impair cognitive, physical, behavioral, or emotional function. Rapid onset of short-lived impairment of neurologic function with common associated symptoms. There are generally 22 that are named. It's a complex pathophysiological process affecting the brain without necessarily damaging brain anatomy. Standard neuroimaging studies generally don't detect concussions, and high school athletes generally take longer to recover from concussions than older athletes. Just symptoms that tend to be commonly reported: headache, feeling slowed down, difficulty concentrating, or a fogginess. They're generally the top few. Just behind the numbers, the Center for Disease Control thinks about 300,000 sports-related traumatic brain injuries result in loss of consciousness every year. This is a huge health issue, and that 1.6 to 3.8 million sports-related concussions occur annually in the U.S. 10% of high school football players can sustain a head injury each year, sometimes up to 20% during their career. That number goes up during college. And in some studies, reported concussion rates in some sports are higher in females than males for a bunch of reasons. In regard to recovery from concussion, most people do quite well after them. About 85% have full recovery in about 7 to 10 days. I would say, though, that each individual that has a concussion should be treated like a snowflake, and that everyone's an individual. So we really can't label and say by a certain number of days everyone should be fine. It's really an individual type of symptoms and resolution. The remaining 15% sometimes don't have resolution within 3 to 4 weeks. That's considered more post-concussion syndrome. Risk factors for slow or incomplete recovery: a prior brain illness or injury, and concussions more specifically, having a learning disability such as ADHD, having a psychiatric disorder such as depression and migraine headaches, and a minority of athletes will have long-term symptoms. So what's our main concern as a clinician on the sideline? Like I said, many of you have heard of second impact syndrome, and that can result in death. Although it is a very uncommon occurrence, it's the worst possible occurrence, and unfortunately, I don't mean to be negative, but that's what we have to look at as clinicians. How do we prevent the worst occurrence? This can happen in an athlete who recently had a concussion and their brain has not completely reset. They've then gone into play, and it doesn't necessarily have to be a very large impact. It can just be a minor hit, and that can set off a whole cascade within the brain, causing swelling and herniation, resulting in death. This most often occurs in people under the age of 21 because younger brains are more susceptible to this type of repeat trauma. So how is this prevented? We can't bubble wrap everyone, but we are trying to ensure that they're cleared. We also don't want to be overly negative and keep kids from playing that should be able to play. So it's a fine line that we need to walk, but we have to make sure that everyone is treated appropriately. And so you'll see today, IMPACT is a neurocognitive baseline test, which I think is an outstanding way for us to see someone's baseline and understand when they've been able to return to their regular function. Neuromotor baseline testing using TRACER, which you'll see today. Serial post-concussion physical examinations. And then once people are asymptomatic and they've gone through their IMPACT test and TRACER tests, they can then be cleared for play. So neurocognitive testing, you'll hear about this more today, but why is this helpful? It's difficult in a setting where the athlete, coaches, sometimes parents, fans want people to return, and you may not get the most honest answer from these group of people. So you need something a little more objective. Grading scales, once commonly used, are no longer relied upon to dictate management, and like I said, the snowflake thought that you really have to tailor treatment to the individual. Symptoms and cognitive dysfunction don't always return simultaneously. Each athlete has a different level of baseline function, and for a lot of these tests, because they're done in mass, and we've done thousands since we started, most players' function is unknown to the athletic trainer or certainly the physician. So IMPACT, as I mentioned, is a 20-minute online test. It takes demographic information along with the questionnaire. It measures different types of functions, specifically attention, reaction time, mental speed, verbal memory, visual memory, and processing speed. And like I said, it gives the clinician an understanding of when the symptoms have resolved and the player has returned to their baseline function. It's currently being used throughout the country. The NFL, NHL, and NCAA are using them. Dr. Collins, who's our keynote speaker today, will tell you some of the research that he's generated, but they have an incredible amount of research that validates this test and has really been instrumental in clinicians like myself understanding concussion and how to treat it more appropriately. It also can determine, like I said, the recovery from injury and specific deficits can be identified, managing patient care, return to exertion, return to academics, and return to play. And it also gives us a way that we can discuss this with the parents, discuss this with coaches and the players, and give them a better understanding of what they have. And having a numerical value or values that you can review with them in the office gives them a better understanding of their issues. Trazer, which you'll see today, I think is fantastic. It's a sports simulator, and it's uniquely capable of replicating the rapidly changing nature of actual competition. The athlete's reaction time to unplanned visual cues provides a measure of the athlete's cognitive prowess during game conditions. The baseline test includes a computerized best test, which is a balance test that you'll see. And within that, there are significantly fewer errors compared to the human supervised test because the computer is following this. It also follows forward, lateral, and rotational movement and provides a composite score. You'll see the demonstration, but it's fairly complex. There's a computer, there's a screen. You have an avatar-like image of the athlete on the screen with a bunch of visual cues and commands. The test takes about 10 minutes, and there's a lot of objective data in that. These are just some pictures. Barry French Jr. is the model on the screen there. What makes Trazer HRA such a great functional tool for concussion management? And I think it's very helpful as a clinician because, as I mentioned, there are objective recordings of baseline functional tests, and the heart rate is being monitored. There's a 7-stage rehab protocol. The post-concussion composite test is a dynamic way to measure the athlete's function for clearance, and it's a great game simulator. So you can put these kids in a simulated environment without the risk of getting tackled or having second impact syndrome. People talk about dogging, in quotes, trying to do poorly on the baseline tests so that in the event that they're smart, these kids. They think, well, if I don't do well on the baseline test, then in the event of getting a concussion, if I'm really impaired, that won't show as much and I'll be at my baseline. Even Peyton Manning mentioned that. But this is difficult to dog in the sense that the heart rate monitor is on and some of the commands are very physically demanding. I've done the test myself and I passed it, but it was a little difficult. A lot of research has been generated out of the concussion summits that occur every 4 years. The most recent was in Zurich of 2012. They have a graduated return to play protocol, and like I said, it's a protocol. It's not tailored for each individual, and I think that there are some issues with that. And I also think that it's hard to mandate what to do for different players, but they do have 6 stages of return to play guidelines. The first is no activity. Second is just light aerobic exercise, walking on a treadmill. The third, sport-specific exercises, so that would be running drills or skating if you're a hockey player. Then that moves on to full contact and practice after the athlete's been medically cleared, and then the return to play. And like I said, there's a lot of variability within each individual, so that's difficult. The injured athlete and coaching staff, training staff, teammates, they all want Johnny Football to come back for the big game on Friday, and so I don't know that anyone's really going to tackle him on Thursday's practice. And I think that better athletes are probably able to cruise through this rehab, and they really have not met their the demands of being able to return to play. So I think that there are some holes within that, and Trazer really helps us with that. So our concussion protocol, we provide the preseason baseline impact and Trazer HRA tests, so we have a better understanding of each athlete's baseline. In the event of a suspected concussion, the athlete's removed from play, whether we're covering the game with one of our physicians or the athletic trainer is there, we recommend a SCAT-3 on the sideline. Those who we think are symptomatic and require further evaluation should be sent to the emergency room, and a head CT may show that there is a bleed or some other issue that is not specifically a concussion, but something that should be medically treated. Refer to our group, Gotham City Orthopedics, or any impact-certified practice. A physical examination, we go over with the parents, because these kids are mostly minors. We go through the symptoms, all 22 symptoms. We discuss how important it is to manage concussions appropriately, and there should not be a rush in some cases to get them back on the field. Post-concussion impact tests are then provided when appropriate. Then go through the rehab protocols. They come back and they have their final HRA test, and then they're cleared. Initially, when someone sustains a concussion, you'll hear more about this later. Rest is something that's very important. Modifying their classroom learning, stimuli are all very important. Sleep regulation is very important. And it's important that all symptoms must resolve before return to exertional activities. But I can't say that as a finality. There are, like I said, individual variations, and each person has to be treated accordingly. But we do want resolution of symptoms. Sometimes they can last for weeks to months, and we just can't sit on that. Very specific rehab sometimes is very helpful. Different medications like amantadine or antidepressants can help. Sometimes MRIs are useful, neurologists, neurosurgeons. We have a large group of people that we refer these patients to when they don't have resolution of symptoms in a timely manner. And again, really we have to keep them out of sports and out of harm's way. Something that makes the news quite frequently, especially unfortunately recently due to a lot of suicides, is chronic traumatic encephalopathy. This is early degenerative changes linked to repeated lower impact brain trauma. There's an accumulation of what's known as a tau protein that can cause Alzheimer's type dementia. That's found post-mortem. Unfortunately, you've heard a lot of these names. Andre Waters, Dave Duerson, Junior Seau, Jovan Belcher. At autopsy, they showed that these characteristic tau proteins were present. So they believe that there is some association between this type of trauma and this accumulation of protein. So maybe it's easier for us to kind of compartmentalize and say, okay, this seems to be something that maybe older NFL players have, but that's not the case anymore. Owen Thomas was the youngest known athlete to date. He was University of Pennsylvania football captain. He committed suicide in 2010, and post-mortem autopsy found that he did have the same type of protein. You may think it's just football. Ryan Friel, first major league player diagnosed with CTE after his suicide in 2012. Patrick Grange was a soccer player. He died of ALS, and CTE was found at autopsy. So it's really prevalent throughout sports. They are trying to do different rule changes, especially in football now and Major League Baseball. They're trying to avoid collisions at the plate. But again, bubble wrap would be fantastic, but that's not really something we can do. And in any contact sport, there is going to be some risk. So the third part of what we do is head monitoring. We began helmet monitoring last year in 2 high schools. I'll show you, it's in my pocket. So it's about the size of a garage opener or a car key, and we fit that inside the helmet. That gives us a real-time assessment and a 3D image of where the trauma was sustained. We can set the monitors at whatever level we think is appropriate. We set them at 10 Gs, and so we were getting a lot of hits registered. And what that can show us, for example, if a fullback is blocking to the right every time, he's leading with his head, we'll see that on the real-time analysis, the front left lobe would light up. And so we think that that's helpful. There's a lot of confusion during a game, a lot of chaos. That allows us to take a look at the end of the game and say, well, these athletes have sustained hits beyond a certain magnitude of force, and maybe if with better blocking or tackling techniques, we can teach these people to put them out of harm's way. We're looking at different companies for the following seasons. We hope that we can identify repeat offenders, like I said, and give them better techniques. But the other thing we'd like to do is establish a hit count registry so that when kids transfer schools or are lucky enough to play in college or the pros, we'll be able to follow them and make some recommendations. Like I said, I don't want to go out on a limb and stand here and tell you that there's a definite scientific correlation. This is what people are alluding to, and it may be specific to each person. So one hit with one athlete may cause an issue, whereas 1,000 hits in another athlete may not cause any symptoms whatsoever. But we think that it would be helpful. So this is the G-Force chip we used last year. It goes inside the helmet you see on the picture on the right. And really, how many is too many? There is a scientific link between the number of concussions and then how easy it is to sustain another concussion. Also, there are issues with sometimes more concussions that you sustain, the harder it is to get back to baseline. So these are just some facts. Athletes with more than 3 concussions are 8 times more likely to exhibit significant cognitive deficits on impact testing compared to other players that didn't have any issue. Thank you for your time.